bad breath is a big concern for a lot of patients who come to the practice. Bad breath can come from digestion, from foods fermenting, and you get just bad breath that way. But if you have the start of any kind of gum disease or pocketing or infections in the mouth, those bugs create certain compounds that cause bad breath. So what do you do about it? You're going to take out your mouthwash? No. You need to have a proper diagnosis. Well, am I loaded with bad bugs that could be causing this aroma coming out of my mouth? Is my tongue cleaned enough, being cleaned properly? So you have to diagnose the problem, see the potential of what's causing it. It could be the gut, it could be the mouth. But you can't just guess. It's like a child going to their doctor who has strep throat. They're not going to open up the mouth of the kid and say, oh, his tonsils are red and inflamed, he's got strep. They're going to do a test. So bad breath, you can't floss away bad breath. I love the Waterpik or the HydroFloss. It's a water irrigator. And that's a great way to start flushing out the gums. And it could work. However, it doesn't negate the importance of seeing a qualified hygienist who understands this conversation. When you put that hygiene scaler in the gums, those bad bugs are very smart. They scatter and they hide in the tissue. So those bugs can't be removed. And then about 6 to 8 weeks later, they come out again and they start creating the havoc. So number one, you need to use certain kind of medicaments. And there are different types of, I'm not talking about high alcohol type of rinses. We have essential oils, we have ozone, we use a CO2 laser. All these things to sterilize or fumigate the pocket that those bugs can't resist. Then what you want to do is maintain a good home care program, because if you go to a hygienist that's trained in this area, they know that there's something called the biofilm. Biofilm is like the sludge on the tooth, or it could be the sludge on the wall. If you have like a jelly surface on your counter in your kitchen, you're not going to just spray it with some cleaner. You're going to spray it, you're going to wipe it really hard, you're going to spray it again and wipe and make sure it's clean. Well, there's a specific program on repetitiveness that you go through with a hygienist if you have these bad bacteria in your mouth.